Yeah. Well, I have some questions from people.
I hope we've covered a lot of
You've
them.
pretty much answered this. Somebody asked, to vaccinate or not to vaccinate? That is the question.
If you're afraid of COVID-19, if you're afraid of getting infected and you're wearing a mask, you're a candidate and you should be vaccinated. That should be.
Are there any legitimate side effects that have come out that we have to be concerned about with this vaccine?
They're minor. The vaccine so far has been very safe.
Okay.
Part of that was the engineering, the biological engineering went into it. You might have a sore arm, and you might, especially with the second vaccine, the booster, if you will, you might have fever and joint aches and muscle aches and feel like you're coming down with something. But it's self-limiting and benign.
Okay.
And like I said before, it's actually pretty good if you have that, because it means you had a pretty hefty immune response.
Yeah, because when we originally were talking about vaccines like weeks ago, you were saying you were not a proponent of taking it immediately. You were saying to wait 6 months or whatever.
Yeah, the data wasn't complete.
Okay, all right, that's a great answer.
Yeah, the data wasn't complete.
But now you feel comfortable having read the. Okay, and we'll post some of the links of some of the studies and such that you found online.
Right, New England Journal of Medicine has actually posted a great deal of stuff that it's pretty legitimate. But Johns Hopkins and their School of Public Health, they have web page after web page.
That's great.
It's just all good
and
stuff.
And obviously, part of why we're doing this.
And all you'd have to do is just go online, get the Johns Hopkins School of Public Health.
Okay.
I think it's called the Bloomberg School, but I'm not sure.
Okay, I'll look into it. Okay.
Okay.
Who has the good one if we get it? Who has the good vaccine? Which is there?
They all appear to have about the same one. The Pfizer vaccine requires some very special handling.
This person also asked the one without the mouse poop. What does that mean?
Which one?
She also asked the one who made without the mouse poop, question mark?
Oh, I don't know which one she's referring to. But I think that was generic medicine rather than generic vaccine.
Okay. Yeah,
the vaccines, not my skepticism, but my wariness is if it's a vaccine that has strange or rigorous thermal characteristics, one that has to be stored at minus 70 degrees centigrade.
Right.
That I would probably avoid.
Why?
Only because it has to be handled at room temperature, and in warming it up and stuff like that, it's clear that a vaccine that requires that degree of cooling is an unstable protein at room temp. So if a group giving it out, like it's CVS pharmacy or whatever, leaves it out for too long, you're not going to get an active response. So I would go with the one that doesn't require that level of freezing, and go to your own doctor and make sure that, because they're not going to choose one that's difficult to handle or requires special training or special equipment, and the Pfizer vaccine appears to need that. And like I said, there are multiple vaccine candidates. They're all coming to fruition. The money to develop them was out there, so I wouldn't be too concerned about whether or not they're going to work. Because if they've gone through the gauntlet of efficacy, testing and safety testing, then they're probably good to go.
Okay.
Yeah.
All right. Let's see. How confident does he feel about the vaccine and why?
How confident do I feel?
Yeah.
Well, like I quoted before, there's a number of actual studies now where you have close to 40,000 people taking it and split the group into a control group and into an active group, and the difference between the two was really remarkable.
Oh wow! Okay. Yeah.
So it was good. It was good, and in that crowd, in that 40,000 people, there was literally nobody that had a bad reaction. But there are things about the study that I, as a physician, was disappointed. They didn't include age groups. There were certain other constraints. I'd like to, rather than have a questionnaire approach where the patient reported after the fact, I think they should have had more hands-on actual examination, maybe follow-up blood tests and stuff. Some of that I didn't see in the study, so I'm looking. And there are other groups. The English have a series of articles in the Lancet, which is their New England Journal of Medicine, and the Europeans in general have been pretty good about it, and definitely areas where they tried to go without any lockdowns and let people follow their own noses, as were like in Sweden.
Yeah.
Well, they had to go to lockdowns in some of their industries. And so just getting natural or herd immunity from natural infection is either not effective, or I think personally, it's not widespread enough.
Yeah.
So in order to get to herd immunity, we're going to need a vaccine.
Okay.
So all of the areas that one would say.
That's all great answers. Do you feel it's being rushed out?
What's that?
Do you feel that it's being rushed out? Like, do you feel like they're just rushing it out and not being efficient with it, or effective? I guess not efficient, but like safe about it.
Well, this is the 21st century.
Yeah.
And it's not a hunt and peck science anymore.
Yeah.
The fact that we can make a genomic vaccine, one that analyzes the genetics and then create something, and we're pretty good. It's not the 20th century, and it's not the 19th, where everything was done kind of like hunt and peck.
Yeah.
So I feel pretty
good
confident.
Answer. I mean, that's a good answer. Okay. Someone wrote, okay, I've heard that the mRNA vaccinations may prevent disease but not infection, i.e. you will not get sick but can be infected and still be infectious to others. I'd love some clarity on that. So can you just explain that?
I think I kind of answered that before, because exposure doesn't stop. So somebody is vaccinated, but they're around another person who's shedding the virus. They'll pick it up and they can spread it. Infectability is different from transmission.
Right.
And that notion that, let's say I've had the virus, I've gotten over it, and I'm well, doesn't stop you from having contact again, and it won't stop you from spreading it. It's the difference between being out in the rain and you come in, you dry off. Doesn't mean you're not going to get wet again if you go back out in the rain.
But you won't get sick.
You
right?
probably won't manifest.
Okay.
But it doesn't mean you don't have the virus.
It doesn't mean you can't still spread it.
And you will spread it.
Okay.
There are elements on the virus side of that question that are important. Because even though you've had contact with it, you have to shed a certain amount of the virus in order for that to transmit.
Okay.
Because the viral burden is a notion that they're exploring. They don't know how much you need to have contact before you're actually beyond the threshold and you get it.
So
the virus itself doesn't survive well outside of a host.
Right.
So within a day or two or three, it's no longer viable.
So in other words,
so it depends on whether or not the subject that's had the viral exposure is actually in the act of being infected. Then they will replicate that virus and they'll shed more. But if they're immune, then they'll not be infected in the same regard and they won't shed as much. And just think in your own experience. You've been around people that have had colds.
Right.
And not gotten them.
Right. And
yet you can be 3 blocks away from the guy that sneezed and you come down with something the following day. So, it's not always the same. There are elements in the individual that count, elements in the virus that count, and elements obviously in the general population immunity that count. So it isn't just simply having contact, walking down the street and giving it to Howard.
But I'm still not really understanding this. So Okay, I've heard that the mRNA vaccinations may prevent disease but not infection, i.e. you will not get sick, but you can be infected and still give infections to others. So that's true.
That's true.
So then, I guess going back to the original point of like, well, everyone's getting a vaccine to protect the population. So does that mean that the more people that get the vaccines, the less likely those people who have vaccines are to still spread it? It's not even that straightforward.
If they're in contact with a population that's also vulnerable and not vaccinated, they can still spread it. Just like if you remember at the beginning of the whole process, everybody was, washing down their mail or the boxes that were coming or the bags from the supermarket and stuff because of this whole notion. That I never said anything about that being important, but we've made this into a world where we can somehow sterilize ourselves and everything. So the point of a person being vaccinated or surviving the infection, they'll still have contact and they could still carry the virus. It's really not that they're infected, but they are a vector. And that means that you can carry it from one place to another, and if you encounter a vulnerable person, they can be infected. The more people that are vaccinated or that have some immune language to protect themselves, the less that transmissibility will occur.
It really is power in numbers.
Right.
You really, as one person, can't really do much.
Right.
Except just hope that everybody does it. And the reality is, it is probably likely that it's going to protect you in some capacity. We just don't have that data yet.
And they have calculated the number of susceptibles versus the number needed for the herd immunity, and once 60% or so of those, I think it's 66, it's 2/3 of the population, have had contact or a vaccine, we're going to see the whole process kind of die out of its own.
Okay.
And that's just built into the way a virus behaves.
Okay.
So it's not so much what we, the individual, and remember, the whole notion is about the general public, not about the person. So even if you're vaccinated, it doesn't mean you're not exposed. It doesn't mean you're home free all, that you're free to roam and not worry about it.
Still be vigilant.
You have to be.
Yeah. Okay. Wow. Good to know. I'm understanding this more. Okay. I think you already answered this, but is the COVID vaccine a one-time inoculation like polio? No. Or is it yearly like the flu? Most likely,
It's most likely going to be a yearly process, but that'll be retrospective. You'll have to look backwards to see how many people still have that vulnerability, and they may do testing for that. I suggest that the way things have been handled so far, closing restaurants and closing places of gathering and limiting people visiting your home and stuff, those notions are going to have to be amended, and they're probably going to try and justify some of it by gathering data. It'll be interesting to see if in that data gathering, testing, that they open up and give honest answers.
Interesting. Okay. Okay. Have read that there have been allergic reactions as a side effect. Is that something to be concerned about?
Well, the allergic reactions that I've heard about or read about were anaphylactic. So patients had anaphylaxis means, literally take the word apart, means without protection, but it's an allergic-like reaction.
Okay.
And that happened to several caregivers in New York and several in London, I bet, and they were documented across. Is that a major league problem? Like any allergic reaction, it occurs in an idiosyncratic or unpredictable manner.
Okay.
I suspect, this is my own opinion, that the patients that were vaccinated who had previously already positive results from a prior exposure, since these were all in people that were rendering care, So nurses, doctors,
Oh,
that was who it happened.
Interesting.
They probably had a positive COVID test, and where they were in their own immune response would predict whether or not they would have a bad reaction.
So it was only medical professionals that this happened in?
Well, the first wave of vaccinations has been going to people that are considered essential medical workers.
Yeah, that makes sense. Is it safe for kids to get it when the time comes?
Good question, and I can't answer that one.
Yeah.
That one, I think they have to develop more data, but I would suspect it's just as safe for a child as it is for an adult.
Well, the good thing is that the virus is not really affecting kids, so...
They haven't done the study with children.
Really?
So, no, children and pregnant women and so on, they just...
The vaccine study, you mean?
The vaccine studies. So when those studies are done, we'll see. But kids tend to be human beings too, so I think they'll well, at least at some level. No, but
that's funny.
But no, but a child, you would expect their biology to be able to enable an immune response. But it's interesting, the first 12 to 24 months of life, they may not get an immune response. The machinery to make all of that doesn't mature right away.
Yeah, I remember you talking about that in our first video about the idea of why vaccines for kids are so important, because kids don't have that, and that's why you said something about like the stamp or the mother's immune system imprinting on them, but that's only for a certain amount of time once they're out in the world.
The immune system in an infant is complex, and it's not mature. It's like anything else. You don't come into this world able to talk and walk.
Right.
And you have to learn certain skills. Well, the immune system's like that. The passive immunity from mother to newborn occurs either through the placenta or through nursing.
Yeah.
So passing immune language from mother to child, and we're not that different from, and you should excuse the expression, cows. But you know, anthrax is a cow disease, and the cow passes in its milk to its calf anthrax antibodies, because if the species were to survive, anthrax is very deadly for cattle. It's not so good for humans either, I might add. But that is a point of analogy to human immunity, and we do need to be programmed. And the program comes in part mother to child, but it also comes mostly from exposure and experience. Part of the experience is vaccination. So you don't want to wait for a child to have the coronavirus-like agent that causes polio without protection. So we start vaccinating them as soon as the system is old enough to support it.
Yeah, I think that's a tough thing too, because like, and I don't even know if I'm, gonna include all this, but that whole concept that parents don't want to give their kids vaccines, this is where it really becomes an issue, and you have to really take into consideration the real science behind all of this.
I know.
And really understand everything before you make that decision. There's a lot of people that I feel like do not understand that. And they're just like, no, I'm not going to give my kids this because it's all this foreign bodies in them. But it's like, that's also part of the whole point.
We don't live in a sterile world.
No.
And the process of thinking that you can kind of wish it away, or I think basic as a pediatrician, listening to some of the patients that quoted for me somebody's study out west that found that the kid would have curly hair and they didn't want curly hair, so we don't want that vaccine. But, or their fingernails would go black.
Wow, I have both. Curly hair and black nails.
No, but the notions of what was scientific, because it was presented. Infomercials are very, very persuasive.
They're so persuasive.
And if you are afraid, if you start off with the fear that this will harm, then you'll find information that proves that this will harm, rather than looking at it objectively and saying, gosh, what does the disease do? Not what does the vaccine do? And I always used to have that as my premise statement when I would discuss vaccinations with parents who always wanted to know what it would amount to. And deservedly and rightfully so.
I understand.
Yeah, but directing towards the right kind of literature or an accurate feed on what does diphtheria do if you don't protect this child. That was, at the beginning of the 20th century, one of the leading causes of death for children was diarrhea.
Really?
Yes. The dehydration was aggressive, the things that happened were aggressive. You could stop that, and we have. But going back to how we got from diarrhea to, what's that in his diaper? That whole process became part of the public health education in the public. And it worked, and now we don't think about it. People don't think about diphtheria.
It's true. They don't think about mumps or measles
or tuberculosis,
right.
or leprosy, or things that our ancestors lived with. When's the last time you heard somebody say, "Hey, I think it's cholera"? It's just,
It's true. I shouldn't laugh, but it's true.
No, but it is. I mean, we've developed a sense of invulnerability to infection, because, well, if you get that sore throat, there's a pill for that, right?
Yeah.
And the change happened in the mid part of the 20th century, called the epidemiologic transition, where we went from diseases that were infectious and acquired to the diseases of deterioration and aging. Strokes and blood pressure problems and heart problems and dementias and stuff, and cancer.
Yeah.
I mean, those are our modern problems.
Yeah.
We don't think of, and whatever does happen, we think we're going to, hey, I'll call this doctor. Now you can't go to the office anymore.
Yeah.
And, or a nurse practitioner, or somebody gets on the phone, you say, okay, I'll call in a prescription without the benefit of physical exam, or, and I don't know too many iPhones that can look up a nose or into a person's ear to see whether or not they actually have an otitis media. That medicine has changed, and the way it's practiced has changed. And I don't know that it's beneficial, but we're going to find all of that out retrospectively.
It's the way that it is now.
That's what it is.
Well.
Okay.
Oh my God, this was so helpful. Thank you, Dad.
Oh, you're welcome.
What?
Well.
You hope what?
I just hope this was useful.
It's definitely. I think so. We'll find out when everyone comments. And okay, so in conclusion, thank you all for listening, for tuning in.
Happy holidays.
Happy holidays, and
stay healthy, stay well.